My name is Dr. Beltray from Beltray Bariatrics, and I'm going to make another video on semaglutide. A lot of patients have asked me about semaglutide for weight loss. Semaglutide, it's an injectable medicine used to treat type 2 diabetes, and it has been recently approved by the FDA for weight loss as well. What does semaglutide do? Well, it mimics or imitates certain type of hormones that are released by the intestines called incretins. So what are incretins? Incretins, like I said before, is a type of hormone released by the small intestines in the presence of food. So we eat, food goes into the stomach, eventually makes it to the small intestines, and in response to food, the intestines releases these incretins or these hormones. There are three well-known type of incretins. There's GIP, otherwise the scientific name for it is glucose-dependent insulinotropic peptide. There is GLP-1 or glucagon-like polypeptide 1, and there's glucagon. Those are the three main incretins or gastrointestinal hormones released. So you eat, food gets to the intestine releases GLP-1. GLP-1 immediately releases insulin, which decreases glucose in our system or sugar. Also tells the liver not to release sugar, further decrease in sugar. And in addition to that, decreases the motility or the movement of the intestines, causing us to feel full, and also decreasing the appetite. This effect is actually reduced in individuals with type 2 diabetes or people with obesity. Like I said, semaglutide is not GLP-1, it's an imitator of GLP-1. It is an incretin mimetic, it's called. That is the scientific name or reference to a mimetic or imitator of GLP-1, therefore copying what GLP-1 does. There are different types of imitators, and I'm going to go through some of the well-known ones so that you have an idea. There is delaglutide, which is otherwise known as Trulicity. This is a once-a-week injection. There is liraglutide or Victoza or Saxenda, also a once-a-day injection as well. And of course, the one that interests us the most, which is semaglutide, which is otherwise known as Ozempic, or its generic name Wegovy. So semaglutide, otherwise known as Ozempic or Wegovy, is the one that we're interested in, and is also a once-a-week injection. There's a PO form, or the form that you can take by mouth, that is known as Rybelsus. There is also exenatide, otherwise known as Byetta, which is a once-a-day injection. Another exenatide is Bydureon, which is a once-a-week injection. Then there's Mounjaro, which mimics both GLP-1 and GIP. This is the only imitator of GLP-1 and GIP so far. So semaglutide or Ozempic or Wegovy, it's the only one approved by the FDA for weight loss. Right? That's very important to understand. How is Ozempic or semaglutide dosed? Well, it comes in an injectable form. It's injected under the skin just the same way insulin is injected. It's right under the skin. It's not a very painful injection at all. The dose begins at 0.25 milligrams once a week. Let's say you come to start taking semaglutide as a weight loss agent. We start you at 0.25 milligrams once a week. This dose can be increased by 0.25 depending on weight loss. It's not like you just keep increasing it every week. No, if we find that 0.25 works for you and you're having good weight loss, we continue on that dose until weight loss begins to decrease, and then we can start increasing the dose once a week by 0.25. The maximum dose is 2.4 milligrams sub-Q underneath the skin once a week. What are the side effects of these medications? Well, there's two types of side effects. First, there is the local side effects or the side effects at the injection site, and this, of course, consists of swelling, redness, itching at the injection site. The other side effect of this semaglutide is gastrointestinal in nature. Remember, they actually slow down the intestines, so a lot of the side effects has to do with the gastrointestinal tract, and the side effects include things like nausea, vomiting, diarrhea, constipation, stomach pains, symptoms of hypoglycemia like dizziness, sweating, slurred speech, and shakiness. What are the barriers to use? I mean, what prevents us from using this medication? Well, initially, what's the cost? These medicines are very expensive. Ozempic, for example, one vial, which lasts you for about a month, costs about $1,000. It's pretty expensive. But Wegovy, which is the generic equivalent, it's much cheaper. and works just as well. And this is the one that we use our office. What are the futures of these incretins and mimetics? Well, the future is very bright. We are supposed to be coming out with a new version that actually is more potent, give you better weight loss, because it imitates all of the receptors. Remember, I said there was three main receptors: the GLP-1, GIP, and glucagon. Well, this one imitates all of them, and it's supposed to come out this year, 2024, and it's called Retratutide. Retratutide is a triple agonist or imitator. However, these medicines are said to be very, very expensive, and we will not really be able to use them until the generic form comes out. But those medicines are coming out for the future. That's great. Who should use these medications? Well, right now we use it in our practice, and basically these are for patients that, number one, want to lose weight and do not want to have surgery, and that's absolutely fine. We use this medication in conjunction, of course, with a good nutritional consultation to make sure that you are changing your dietary habits. You are being treated for weight loss with this medication. Remember, you cannot take these medicines forever, right? But at least it gives you the initial weight loss to get you started with the weight loss. But in the meantime, very important that you consult with a nutritionist and continue making the changes that the nutritionist asks you to, so that you not only have the initial weight loss with the injections, but once we stop the injections, you continue losing the weight, because again, you don't want to be on these medicines indefinitely because they do have side effects. The other way that I'm incorporating this semaglutide into my practice are for patients that already have surgery. They either had a gastric bypass, they had a gastric sleeve, a duodenal switch, and they hit a plateau, or they're not losing any more weight and they want to have additional weight, they haven't reached their goal. Well, I'm using this medication to kind of restart the whole process of weight loss, the whole metabolic process of weight loss. Because remember, once you have a sleeve, you have a gastric bypass, you have portion control already. Maybe the metabolic effect of the surgery may have run its course and therefore weight loss slowed down. Well, I find that by using this medicine, I can restart the weight loss process. Of course, again, it is a combination of the injections with going back to your healthy eating habits. So the other way that I am considering, I haven't done it yet, in using these medications, it's combining it with the surgery. There are certain individuals, for example, that are 500, 600, 700 pounds and are 300, 400 pounds overweight. And I find that doing a sleeve alone might not take them to the ideal body weight that they're looking for. And I find that maybe starting using these medicines early on, before weight loss slows down or stops, might enhance the metabolic effect of the surgery and have them lose even more weight. Have not incorporated it in that manner yet. It's something that we are thinking about doing. Well, I hope you found this video informative. Again, my name is Dr. Beltre from Beltre Bariatrics. I am a bariatric surgeon in the area of Orlando, Florida. Thank you for watching this video, and I hope that the information was worth your time. Thank you.